I felt in the traditional practice we were not really getting the job done. We were pretty good, and I think traditional practice is good, we were pretty good about putting out small fires. What we didn't have the time or resources, but mostly the time to do, was to get down to the root cause of a lot of these problems in the first place. I think the goal of family practice, primary care nowadays, is to spend more time and resources on prevention and early detection. Nobody's doing that.
Practicing in a practice like PartnerMD, where you have the opportunity to address not only ongoing medical concerns of the patient, but also to address the lifestyle issues, I think make a big difference in the overall health of a person. We talk a lot about helping patients age well, and a lot of the opportunity to improve your vitality is based on what you do to yourself. So we stress a lot with our patients things such as improving their diet and getting into a regular exercise program, because we feel it pays big dividends for them in the future.
You can do more in-depth history taking and physical exams, and spend more time with patients and not get behind. And I found that to be a refreshing change from my old style of practice.
Sometimes you feel like you're just doing crisis management rather than patient care, so it's a little bit frustrating with that kind of practice. And it was a pleasure to move here because it has slowed down the pace.
It's nice to have the time to engage patients in discussions with some of the pros and cons of some of the newer tests available, and feel like I can much more thoroughly take care of their problems, and that's very satisfying.
90% of the diagnosis is made by talking to patients, and that takes a lot of time. You can't do this in 5 and 10 minute little bites. So we have an adequate amount of time, and in addition to the time, we have the resources and the staff to coordinate the care properly, to coordinate the workups properly, and to again get after the cause of a lot of these a lot of our patients' concerns.
A typical primary care practice, the physician may be having to see anywhere from 25 to 35 patients a day. PartnerMD, I see more like 10 to 12, maybe 14 patients a day. So I'm spending more time with fewer patients. Patients
Seem much more at ease, the staff seems much more at ease, they're not as rushed.
The concerns related to was this going to really work in a community such as Richmond? Richmond is known as a relatively conservative community, and this was a new idea, but my concerns were quickly abated.
My only fear was that I wasn't really sure that it would actually work. It's kind of too good to be true when you think you're only going to have 600 patients and have 30 minutes per patient and see an average of 12 patients a day. And I really didn't see how that could be possible, and really my biggest fear was that it wouldn't be that way, but it has been so far. It's been great.
It is a real luxury nowadays in all aspects of our society, I think, to have the time to really dig down and get after the problems and deal with the problems in one setting. My patients just seem to be thrilled by this opportunity.
Your call actually is lighter than it is in a traditional practice. You're available to your patients during the day. You have a smaller number of patients that you're responsible for at night. So the call issue actually has been a pleasant surprise.
95% re-sign-up rate, which was very reassuring to me, and I've been happy to discover that the re-sign-up rate here is very high. And before I got here, I thought, well, people may try it for a year or so, but will they be willing to spend extra money for extra care? And the answer has been yes. But
PartnerMD, your revenue is based on your ability to attract and maintain patients, so you don't have monthly swings in your income. You know what your paycheck is going to be, and it's coming whether you've been on vacation the previous month or not.
We're compensated on a salary. We're not compensated based on the number of patients we see, and actually that is takes a lot of the pressure off of what you're doing when you feel like you're just trying to see as many patients a day as you possibly can so that you can be compensated at a higher rate. I think you may tend not to provide the care that you'd like to provide.
So it's been a tremendous plus of being able to see a much lighter load. As I tell my patients, it's just a breath of fresh air.
the future of primary care medicine is the early detection and prevention of chronic disease. I think medicine has done a pretty good job of, again, putting out fires and taking care of acute situations. But very few people nowadays are spending the time and the resources to get after the underlying cause of what really plagues us going forward in our lives. The early detection, consequently the early management, and if possible, the prevention of chronic illness that we all read about in the papers these days.
I think clearly the primary care system needs to be more preventative in nature and not so much reactive.
You know, studies have shown in the last several years that fewer and fewer medical students are going into family practice, internal medicine, primary care in general. Primary care doctors are working 70, 80 hours a week and are compensated, you know, when you look at all physicians, are compensated on the lower end of physician compensation.
I was actually giving a talk to some physicians out of town. One of my patients was playing soccer and called me on my cell phone because it was after hours and he needed to contact me, and he had injured himself on the soccer field, and we sort of talked about what the appropriate actions would be, and sort of my final statement to him was that I thought he did not need to have to go to the emergency room or anything that night, but I wanted to run his case by an orthopedic surgeon briefly, and I would call him right back. Called the orthopedic surgeon, who happened to be driving right past the soccer field where the patient was playing, and offered to go see him. So called him back right away and said, if you'll look up, you'll probably see the orthopedic surgeon walking to you right now. So I had a patient who called me, was injured on a soccer field, and literally we had an orthopedic surgeon there to see him within 2 minutes. So that doesn't happen very often.